Health Matters with Dr. Gerald Thompson, and Your Health Matters is being brought to you with a kind compliment of People's Pharmacy.
Your health matters.
How much do you know about what makes up a healthy lifestyle?
Your health matters.
How do you define good nutrition?
Join Dr. Gerald Thompson, physician, specialist, and notable environmental conservationist, every Wednesday, 8 to 9 p.m. here on BFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology, and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. on BFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Over to me. Is that it?
Yes, good night to you, Dr. Gerald Thompson. Happy.
Thank you very much.
All years, but all the best for 2026.
Same to you, Kamal. Same to you. The infatigable Kamal Archibald. let me say yes. This is the last show of 2025 on the last day of 2025. Normally, I might have skipped this show in terms of All Year's Night, but I thought it was important as we usher in 2026. It's early in the evening. We're not going to see the fireworks until a few hours later. We're not going to see, the various wines and other things like that come out at that time. But for the last few weeks, matter of fact, today, my family, the Thompson family of St. Vincent the Grenadines, has been celebrating a reunion. And we started on the 23rd and went right through today. We donated packages and scholarships to the Chateaubriand Government School and also to the Chateaubriand Smart Hospital. And it was a very rewarding 9 days. And I want to thank all the various Thompsons and persons who helped facilitate us, whether it was our meet and greet, our parents at 9 mornings, whether it was our Christmas Day luncheon at the Mangrove, or whether a visit to the beach, or whether our climb of La Soufrière, whether our banquet that we had at Spring Garden and other events, it's really been remarkable. So in this last show, though, I want to highlight a few things, to reflect briefly on 2025, and to talk about what to expect in 2026. Now, a lot of this year's global 2025 health news was quite exhausting and demoralizing. It wasn't as demoralizing as previous years when we had COVID and so forth. But what we saw was with the new government in the United States, the Trump administration, they weakened a lot of the scientific agencies, CDC, National Institute of Health. You may say, well, why am I talking about those things? Well, I would have visited and actually done work there when I practiced in the United States as an infectious disease specialist. But more so, that their activities impact on what takes place around the world, especially in Latin America and the Caribbean. And, the activities, the whole questioning of public health and science. I've got to say that. There's been widespread attack on science. Science is a waste of time and so on, and all that sort of stuff. Now, at the same time, there have been deadly outbreak of measles in these countries. Bird flu, foodborne illnesses have impacted us here in the Caribbean. Infant botulism, that hasn't come here, but among other things, that have shone a light on the holes that now exist in global, regional, and national surveillance system. It's important to know what is going on around the world, what is going on in other countries of the region before disease and illnesses hit here in St. Vincent. Data is so critical. Now, the Department of Health and Human Services, the HHS, took particular aim at the life-saving vaccines. I have been a specialist in the vaccine era. I know how important there is, but I will admit to you that there's been widespread changes. The concept of choice, those who have choice and those who basically have a choice of not taking vaccines in particular, has come to be full circle. And you know, there's one particular vaccine, hepatitis B vaccine, that now the city now promotes individual decisions for newborn. That means parents, ending the universal birth dose rule, where vaccine of hepatitis was given to children. And so, especially for babies who are hepatitis B negative mothers, who can now delay the first shot until at least 2 months old, and discuss the timing with their doctors of when they would receive the rest or any other additional hepatitis vaccine. Clearly, what this means is that kids just simply won't receive hepatitis B vaccine if it's left in that way. But the whole issues of whether something is required and is needed before they go into a nursery or a preschool, hepatitis is one of those that's now been taken off of the list, and more extensive changes to the vaccine schedule next year. For St. Vincent Grenadines, we have virtually 100% vaccination rate for a number of things. But it wasn't all bad in relation to the health field, the science and health field in 2025. There was a number of exciting discoveries. I want to tell you, we're not going to talk much about them. The male birth control pill. Male birth control. Have you heard about that? Well, that is now here, 2025. And there's also a big thing, something called GLP-1 weight loss drugs. GLP-1 weight loss drugs. They basically dominated the news in 2025. And weight loss drugs is going to dominate the news in 2026. Now, let me go through 7 things to watch out for in 2026. I'll go through them quickly. May open up the lines, get some comments. Now, I am going to be touching on some science, in truth, right? So I hope that I don't get into too much detail or lose you on All Year's Night. But GLP-1 pills are here. This blockbuster weight loss medication, some of the names, let me just give you the names. Wegovy, W-E-G-O-V-Y, Wegovy, and Zepbound, Z-E-P-B-O-U-N-D. I won't give you the real science name, but these two have been in the news a lot in a couple of years. And studies of these two drugs has shown their potential for triggering profound weight loss and treating metabolic, heart, and kidney disease. Persons who have been obese are now taking these medications. Now, Firstly, these medications have been out in injectable forms. You must get in an injection, and that will last you for a month, coming back for another injection. Now, the companies that make these popular injectable medications, right? What we call glucagon-like peptide 1. That's what we call GLP. Glucagon, Glucagon like peptide, Peptide 1. That's GLP. That's why glucagon-like peptide 1 drugs are developing pills for weight loss. Wegovy manufacturer, the first one, right? Their pills were originally diabetic pills. Let me put it that way, right? And they have now these new pills that have been approved since 2019. And a version of this pill has been further developed for weight loss. And on another company, Eli Lilly, a big pharmaceutical manufacturer that makes the Zepbound, Zepbound, has a pill in the works too, just like the injectable. And basically, these are going to revolutionize weight loss, because obesity, weight gain, obesity, morbid obesity are big things that contribute to a lot of heart disease and death here in St. Vincent. The next thing is measles. Because I was telling you about changes in vaccine approaches where people are being allowed to say, I want to make a choice with measles vaccine for my kids. I want to hold up. But measles virus is one of the most contagious viruses known in this world. It can spread so fast you won't imagine it. I can tell you. But measles is funny. Not only does measles cause a rash, but measles could also go to the brain and cause your brain to turn into like porridge, something called encephalopathy. The measles virus could also affect your lungs and cause measles pneumonia. These people don't typically recover well. There's a lot of deaths that can occur if these people get those conditions. Now, most people will get a rash alone. I must say that. But when you have vaccination rates dropping below 95%, 94%, measles outbreaks are sure. Luckily, St. Vincent has a measles vaccination rate of almost 99.9, almost 100%. We're keeping up there. But once that slackens off, you watch, you'll see some of these outbreaks. And some of these patients will get the brain porridge and the measles lung type condition. So these extremely contagious yet vaccine preventable illness was declared eliminated in the Caribbean and the United States since about the year 2000. But in the past year, there's been large outbreaks in Texas, Utah, South Carolina, where they have freed up the choice issues, and a lot of people have taken choice. Canada lost its measles-free status in November of this year. And if measles spread continuously across the world for 2026, the disease will be considered to be endemic again. So that's a problem. Now, I want to get into some real science. We have been taught to hate things like gene therapy, anybody affecting our DNA. And so we don't like that. We sound skeptical. But personalized gene therapies, PGT, personalized gene therapies, This is going to be the big thing for 2026. In May 2025, the world learned that a baby boy with a rare life-threatening genetic disease had become the first person to receive a gene editing treatment. Gene editing treatment. The gene editing tool that was used by scientists had already been used for a number of years now to cure people with sickle cell disease. But this was the first time it has been used to develop a treatment for an individual with a specific mutation. And mutations are taking place, for in relation to many diseases. So these therapies can take years to develop. So they are unlikely to bring cures to other genetic diseases immediately. But in the upcoming year, we'll be watching the whole science of personalized gene editing treatment for things like that. And since we're a country that has sickle cell disease, watch out for that disease in particular. Now, I could tell you about a third thing to watch: bird flu. We are going to see more bird flu. When we assess the flu, you will hear two terms, H and N. These are the way we kind of describe the flu. So the bad bird flu we're worried about is called H5N1. H5N1. And I'm not going to get into detail as regards what does H mean and what does N mean and why 5 and not 4 and not 3 and 2 and why 1. But basically, this type of flu is a H5N1 strain, right, of avian influenza or bird flu. And it has been sickening wild birds and other animals for several years now. It also affects cattle. In the United States and in South America, it's been affecting dairy cattle. It's been affecting poultry. And the outbreaks in chicken, these have been so deadly that sometime early this year, the price of eggs spiked. We may not notice it. I don't know if you folks notice the price of eggs gone up. I'm so pleased about us trying to develop our own egg industry, rearing chicken to produce eggs. But we also have to be careful because these H5N1, when those infected birds come down, they can definitely affect your chicken cubs. They can affect other birds that live on the island and can cause a lot of death. But, we are going to watch and see in the latter part of 2025, there's been a surge in bird flu. A surge in bird flu. Now, let me just say, H5N1 has already caused 71 human cases and 2 deaths. In other words, it's a bird flu. But guess what? It has been recently affecting humans. And since 2024, according to the same CDC, we have to be very careful. Now, the virus doesn't spread efficiently between a human and another human, but we have to watch it very, very carefully. Now, an exciting area for me, as a person who looks at immunology and infectious diseases and your whole immune system, we've discovered a new type of white blood cell. This year was a big year for research of the immune system. And they discovered another type of T cell, another type of white blood cell that stops the body from attacking itself. Let me repeat that. A white blood cell floating around your body And these special white blood cells differ from other white blood cells. You know, white blood cells can fight off infection, can fight off parasites, can fight off viruses, can do various things. They're important in the immune system. But these special white blood cells, they roam around the body and they help to stop your body from attacking itself. Man, this is so big. So big was this. These peacekeeper cells, these peacekeeper white blood cells, the discovery of them won the Nobel Prize last year. And next year, these regulatory, peacekeeper cells, they're looking at therapies that they may be able to collect these peacekeeper cells and give them back to some patients to help them to protect themselves, protect them from their own body. Like if somebody had a skin transplant or kidney transplant or heart transplant, your body tends to attack that kidney, attack that skin graft that we put on. So by giving you these special peacekeeper cells, it will help to stop the body from attacking itself. This is really big. I know it sounds sciencey, but it's really telling you how it's really going. So people who might need bone marrow transplant or these sort of things because they have a cancer, they have a leukemia, they have something in nature, and they may be getting in some stage some of these peacekeeper cells that will help to prevent them from attacking themselves. And better donation of body parts, kidneys, things like that, bone marrow can take place. Now, I want to say something else. Now, what if you went to the doctor? Or what if you went to a doctor online, but it was not a real doctor? It was an AI doctor. And you hear the AI will see you now. In other words, normally you would hear the doctor will see you now. Well, what if it says the AI will see you now? The AI doctor will see you now. So artificial intelligence, and specifically generative artificial intelligence models, are now reshaping a lot of fields right now. And medicine and healthcare are no exception. Models already exist to predict a person's risk of developing breast cancer. And researchers are now using AI to predict someone's risk of about 1,000 different diseases. Yeah, 1,000. Now, we are going to have to closely watch new uses of artificial intelligence in healthcare in 2026, in which persons are going to be going more to these computerized models and asking them, what is wrong with me? And a few questions will be asked and so forth, and they may be coming back and saying, try this, try that, use this, use that. I have no doubt that these things will need some perfection, but look out to hear a lot more about this in 2026. Now, what does this really say about the direction of medicine in general? What do we want? We all want to be a little bit more healthy, but we also want that if we get sick, that we are fixed quick, that we get better quickly, and there are means. We want the healthcare to be affordable, but we don't really want to skimp on it, you know? And this is going to be one of the challenges. We're also seeing a dramatic rise in the cost of healthcare. And in some countries, there is just, I mean, it's just phenomenal what the cost is running. For St. Vincent and the Grenadines, we are constructing a new hospital that is supposed to offer a number of new services and expansion of other services. There was a time when persons had to do a raffle or a sponsor sheet for people to sponsor them to raise enough money to go overseas for a CAT scan or MRI. We now have dialysis being done here, and people being transported almost free of charge to the dialysis centers to reduce their costs. And there's certainly been a fair amount of advancement in this regard. The thing is that for us in St. Vincent, we are going, I think, to see an expansion in access to better healthcare. And there are a lot more trained doctors. You've heard me mention about artificial intelligence. Well, several hospitals around the world, especially those in the World Pediatric Center, have been using televisions and video conferencing and cameras to look at patients with the doctor in one part of the world, let's say United States, and the patient here in St. Vincent. And it has worked fairly well. And you're seeing surgery being done remotely with robotics. And I think we're going to see a lot of these things come to St. Vincent. The hospital at Annisville may not be finished in 2026. I hope it will come close, but it's well on the way. And it's certainly going to offer a lot more access to the people of St. Vincent and the Grenadines, especially those in the Grenadines. I understand the plan is there to have a helipad, and a helicopter could go down to the Grenadines and get people up very quickly. And with the system of polyclinics that they have, where you could go there first and even to other hospitals in and around the country, you can get initial treatment in those places before you're referred to the acute referral or acute care hospital at Annisville. So I think it's going to be an exciting time to watch here on the ground. And with some of the new developments I've talked about, 2026 is going to be, I think, a good year in healthcare. Barring that we have no disasters, barring that we have no outbreaks of anything, we don't have measles or bird flu or anything like that breaks out here in St. Vincent. But I want to conclude before I open up the lines that one thing that I'm hoping we will see a lot more is people taking greater control of their personal health and nutrition for 2026. Getting up, going out, and really trying to take care of yourself, reading more about it, being a little bit more natural, trying to make sure you're not shoveling down a lot of toxic chemicals into your mouth and into your body. For some of those people into beauty, also making sure the products you put on your skin and in your hair and on your body are not products that are also toxic to your skin. You don't want that. And certainly in terms of our environment, in terms of how our environment it relates to various illnesses, you have to be vigilant. vigilant about what you're putting into your body, what you're eating, but also vigilant about how much you're eating. I mentioned about these GLP-1 medication for weight loss. Well, clearly a lot of people have been overeating. And you've heard of malnutrition, where persons are not getting enough food. Well, malnutrition could also include where people are taking excessive food and are overeating. And as a result, they're putting on weight, they're obese and so forth, and they can't stop. Well, I'm really happy for these GLP-1 medications. They have to be monitored very closely. Whether you get the injectables or you get the tablets, I think they could be a good thing, and they're proven to be relatively safe if taken properly. But once again, the important thing is that why are you obese in the first place? The need for exercise, managing the amount of food and calories that go into your body, understanding what is too much, understanding what is toxic, understanding what is going to be converted, what's there on the labels, and seeing the fine print. Labels are supposed to reveal, but sometimes a lot of fine print that don't really quite tell you what's going on inside those particular foods. Your knowledge is really critical. Now we're going to take a short break. Remember, we're going to open up the line 457-9997, WhatsApp or direct. Certainly happy to take your calls. And I don't know if this time of night, on Old Year's night, we'll get persons calling, but persons, if you have any burning questions that you really want to tie up for 2025, you want to ask as we usher in 2026, then we'll certainly be happy to address some of those questions the best way we can. So Kamal, let's take a short break. Let's hear our sponsor, and let's come back and we'll open up the lines.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, Kamal, and we're back. Well, Kamal, I got to throw it out to you. First of all, are there any texts or anything like that? But I certainly
So far, I haven't seen anything other than what you're saying on the where James Ford and Val Batiste are saying good night to you.
Yes, thank you very much. Thank you very much. But I wanted to ask you, and I sometimes, have you as a little bit of a guinea pig. I think I throw some tough questions to you sometime. 4 or 5 years ago, I would throw to you about health. You say, "Man, I'm fit," and you look fit. You still look fit, but I'm not bringing up any personally. But what sort of thing concerns you about yourself or your family, your parents, or whatever the case might be? What sort of questions would you have or ask in relation to, people feeling and looking better, than what they have been? Are there any questions you have observed or noticed?
Well, I would not so much point it to family members of such, but in general, as regards to people health, what they eat, do they exercise, and things like that. Because of what you're saying, what are the things are some of the things that you see people eating. Most of the times you don't see people exercising. You probably just, everybody you just see driving now. Everybody have a car. So the least little journey that they have to make, they jump in the vehicle and they move from, I'm more concerned. And then again, you see people and you see the added weight. Sometimes you see somebody and you don't want to say to them, boy, you look like you put on, especially ladies, you don't want to say, boy, you put on a few extra pounds, because they might feel away, you know. But the tendency is now to look at people and see the difference as in terms of the body weight. So you ask yourself, are they really conscious, self-conscious of what they eat, whether or not they exercise and stuff like that?
You said something important there in the beginning. You think that around us, we do see persons who are putting on weight, who are becoming, the excessive weight, but we're afraid to discuss it with them because it may embarrass them, it may insult them, it may make them feel upset, and they typically do get upset if you tell somebody, oh, you're looking plump, or you're looking tantalizing, or you're looking, you could use various words, but they all mean and can be interpreted that you're thinking that I am fat, right. And they walk away very upset about it. How do you think that is a challenge talking about these particular things?
It depends on the relationship that you have with the person.
Yeah.
If it's pretty candid, I mean, I could look at you now and say, Doc, look like you're trying out some weight there, boy. Like you're eating much or whatever.
I look at see my face. My face. I lost. You see my skin hanging down. I need to throw on some weight.
But no, but some ladies, in general, ladies. But funny enough though, you find yourself saying it and they don't have an issue with it.
Yes.
I think someone told me already, well, I fast, I put on weight. I eat, I put on weight. So you know what? I just eat it.
Mm-hmm. Well, that's one of the things. For 2026, it's being predicted that data is going to be more important. But the data we're talking about is if you're able to get onto a scale and just check your weight, it's a good thing.
Okay.
If you annually, you go and you get a set of blood tests, a blood count, and some chemistry, it can be very useful because if anything happens to you, is it a good thing to know your blood type? Kamal, do you know your blood type, your blood group? Do you know?
I can't remember, but I do have I have a document home with it.
Right. And so these things are important. Now, everybody should also have a proactive and preventive focus. A strong emphasis on early detection by screening or advanced diagnosis, lifestyle assessment, and community health initiatives to reduce long-term costs and improve outcomes. Let me just say this. If you are a woman and you at certain ages do not have never had a mammogram, or you do not examine your own breasts, or Kamal, if you have a female partner and you don't help to examine her breasts and you don't know the contours of her breast, you may miss a lump, which if picked up early can help save life. For men, in terms of the prostate, it isn't that somebody is going to stick a finger up your backside alone. We can do blood tests first. We can do blood tests to see if it's elevated. Usually you might need both, but by doing the blood test, at least we're picking up to see if your PSA, which indicates prostate health is going through the roof. And changes in your bowel movement. If you find your bowel movements are going funny, strange, it may be that, for certainly, if you have a family history of cancer of your colon, cancer of the intestines, you should now get a referral to Georgetown, where they can do a colonoscopy to check and examine, see what down there and inside there looks like. You know what I mean? Come out.
Yeah. Well, Doc, I can say this publicly. I've had a prostate test done before. Not I did the blood works, right? And it was very simple. It was just going to a doctor and letting them know that you want to get an examination done. They write up whatever they write on the paper. You take it to the lab, and well, if you're as cool as I am, you could just open it and read it. You could just take it back to the doctor. But the point of it is that it gives you a good head start to know where you are. Because a lot of guys are afraid of the physical, and quite understand. But what I'm saying is that the blood work tells much and could say to you then that, oh, you know what? You really need to get this manual, or you're good. Yeah.
But the point is that a stitch in time saves 9. And it's not going to save 9 in terms of cost, but it could save your life. It could extend your life, right? So cost and life. By being proactive and doing the screening, knowing your numbers is important. Now, I want to touch on another subject in terms of integrated mental health care. And around us, we really have to see, expanding the capacity to be able to look at anxiety, look at depression, look at PTSD. It's amazing that there's a condition called post-traumatic stress disorder. People who've been raped, people who've lost a limb, lost an arm or a leg, they really, people who have been shot or bullet is whisked by them, or somebody has planned them with a cutlass, or they've been chopped with a cutlass, they can go through post-traumatic stress disorder. Most of the time, we look at people who've been near an explosion. But if there's a landslide and the mud buries you and they fish you out, you will suffer from post-traumatic stress disorder. You'll wake up with some nightmares for periods of time. And there are ways of getting over it. You can get over it. And that's really important. Another area is the workforce empowerment in your job. We spend a lot of time on the job, hours on the job. And the private sector, the public sector must be really conscious that all these individuals who are sitting down there or working there, that empowerment to do more, to help prevent burnout, one, and to make sure those persons who are weaker in terms of they have sugar, they have pressure, really how if somebody's sugar is high for most of the work day, somebody's pressure is through the roof and their heart is pounding all day, you're not going to get the best out of them. Or in a couple of years, you may not even have them. You know what I mean? They may be gone. So there's a lot to really indulge in. One of the other things I would want to say is trust and experience. I think coming out of COVID and the vaccine, a lot of people have lost the trust in aspects of healthcare, doctors' recommendations, so forth. And a lot of people go into social media where they are at risk of just following the dotted line. And I think doctors themselves have to become and regain that sense of talking to patients, getting back that element of trust. And I think that would be very helpful. Well, Kamal, we still don't have any calls. We don't have any persons texting, you know. I think that I have gone to parts of the world where the cost of healthcare is just astronomical. To see a doctor, I mean, if you get a catastrophic illness, you literally might end up losing your house. You got to mortgage your house. You got to sell your house. You know, so if your wife is very sick, you got to sell your house in order to help save your life, the life of your wife or your loved one. And that can be challenging. And there are other places where you're so far from a health center that access is very, very, very poor. So that I'm pleased in Simpson where we're getting access. There are many places, whether it's a village clinic, or whether one of the regional hospitals, or whether it's a polyclinic, or whether it's Modern Medical, or soon, you know, the Milton Cato Memorial Hospital and the Annesville Hospital. You know, there'll be a lot of places that where accessibility is going to be available. And we hope that cost also remains down. Because cost is ever rising. The cost of equipment, the cost of different type of medications and so forth. You know, you have to expect the new medications, right? The companies that make new medications, they want to get their money back quick. They want to get a return on their investment. They've invested heavily on studies and they want to get their money back. But boy, the cost of some medications, you know, $2,000 for a 1 month supply, $1,000 for 1 month supply. That's madness. You know, unless there's insurance, you can't afford that. And we're seeing insurance companies folding. We're seeing insurance companies getting out of the business. It is gonna be complicated. But I am still quite hopeful that we have been seeing an improved level of healthcare. I'm a student of health history. And, you know, long ago, Kamal, the deadly diseases of the plague and cholera, these things used to ravage the globe and kill lots and lots of people, you know? And we then, at the turn of the 1900s, we started seeing polio. Do you know polio didn't exist for a long time, you know? We started seeing that around the turn of the century. But polio has been caused by a virus. Do you know we only really started to know about virus in the early 1900s? Penicillin was only invented in 1930 and only went into full use in 1942. In other words, it's only been, you could say, 120 years. Or what I put say, let me correct that. It's only been 80 years since penicillin has been around. You know? It's only been 80 years. 80 years. There are people who are over 80 years. When they were born, penicillin didn't exist. There was no such thing as antibiotics. There was no such thing as diabetic pills. You know, there's lots of medication in the modern era that have come and been developed that are now helping to treat illnesses. Today, plague, the disease called plague still exists, but guess what? We have the antibiotics to treat it. So nobody dies from the plague, whereas the plague would have killed 50 million people way back when, you know? And these have been deadly diseases that reshape the world, reshape the earth. I believe that healthcare is a positive thing, but we're fighting a battle because there are these new diseases coming out. There are new environmental diseases. Climate change is causing mosquitoes to spread more. As we dispose of our plastics, as we dispose of our toxic stuff that help make things, we're seeing our environment become more toxic. Is the environment itself causing diseases? It's bubble gum, the things we eat, the sugars we sweeten our food with, the excess sugars we take. All these things have been a problem.
We seem to have a caller.
Yes. Hello, good evening.
Dr. Thompson, one of the things I definitely disapprove of it, every single, a million of them on the screen, in the television, advertising their medicine. Buy one, get one free. But not one of them has ever stated that these things have been tested and tried in a medical lab and approved by the Doctors Association. Why are those things being permitted?
Well, I can tell you it's a big issue. There is something called over-the-counter and freedom of... During the COVID pandemic, the vitamin people saw that if people could buy vitamins, let's say they have 20 vitamins, vitamin B1, vitamin B2, vitamin B, a bottle of this. Everybody had a bottle of, I'm not talking about a bottle of multivitamins, but a bottle of each type of vitamin and each type of mineral. Somebody would take 20 different tablets, sometimes take 2 of each. They're taking 40 tablets a day, and they were...
I am saying to myself, things are getting totally out of hand, and they... in any case, thanks very much. I just wanted
Thank you very much, yes.
I keep telling people this thing, and I just wanted to say it again. Thank you.
My pleasure. And I think that's a very important note, because there's a lot of false advertisement, and that's been one of my own missions. I do believe that there are a number of plants and a number of plants with active ingredients in them that are very helpful. At the same time, there are some that may not be. But there are other persons who are selling different concoction. There's one, they used to sell colloidal silver. There's all sorts of different brewed up stuff that people will get on and say, this is my therapy and it's being shown to this is, but they haven't had it approved. And so part of this is to do the studies can cost millions of dollars. So it's hard for somebody to get the study done. But unless studies are done in a particular manner, you can be causing lots and lots of problems. You can be lost. So that was a very, very important point that was brought out there. And in 2026, unfortunately, you will see a lot more people advertising this sort of thing. Kamal, is another call there? No?
No.
Yeah, you will see a number of persons advertising products because there is some greater freedom being given to this. During the COVID-19 pandemic, Donald Trump said, why don't you take hydroxyurea? Then he said, why don't you take ivermectin? And these medications did not work. It's not that they didn't work for some people. They work, but they didn't. The studies didn't show that they were effective with large-scale use. And the healthcare industry is $1 trillion industry. And people whether they make money for 1 year, they feel they make a lot. Whether they could go on, stretch on before they're detected, for 3-4 years, they'll even make more. But look out, double check on what is being done. At the same time, there are lots of surgeries that have been done unnecessarily. There's all sorts of new treatments that themselves do not work, where people could feel they could cleanse your blood, they could get spirits out of you, they could do all sorts of things. Now, some people will be caught by that. If I want to sell you the bridge in Barralee, the jetty in Barralee, I'm sure if I really go at it, I could find lots of people around the world who will buy that jetty, but I'm not able to sell it to them. So people, there's a lot of scams out there too. But don't be discouraged that because there's one scam, everything is a scam. It does not necessarily mean that way. So for 2026, it's going to be important to read. Yes, go on social media. Yes, go on the internet. But what I want you to do is don't just pull up the first article, which are usually paid advertisements and so paid so that they will come up first and you will see them first. Do some further searching to see if other articles say the same thing. If other authors, not the same author repeating himself in many different formats, but if other people are actually saying the same thing, and if there's studies that are done, research this. But more so, I think there are still some good things going to be happening in 2026 and beyond. And we have to, I want to thank WeFM. Kamal, I want to thank you very much for all the assistance that you have been giving and providing. You know, I sometimes throw you under the bus. I sometimes throw a hard ball and a googly at you and so forth. I apologize for it.
All in good faith, right?
Yeah, but sometimes somebody knock me for 6 and so forth. I accept that. I don't like being hit for 6. And other callers and so forth, as you call, I appreciate everybody, you know. And I really look to appreciate that, you know, there are persons who are going to pass away. And they will pass away from all different sorts of illnesses. But if we can extend life, but by just a few more years or by many more years, it's a good thing. And so Your Health Matters is a program that serves to touch on little tidbits, to give you a little hearing that's interactive. So for 2026, we'll be back and we'll be willing to take your calls and hope you listen to what we have to say. This is Dr. Gerald Thompson wishing you a very wonderful 2025. Hope you have enjoyed it, but at the same time, wishing you a happy new year and a wonderful and prosperous 2026. Let me end a little early. I'm ending a minute early, right, Kamal?
Yeah.
But you know, I am ending a minute early so that I could allow the next show to be queued up. I apologize. I always go over by a minute or 2 or 30 seconds. So I say, let me give back to the next show.
Yeah, I know. And I get hammered like 5 minutes after. I get hammered like after the program, but like an extra 5 minutes.
You do? All the best, and do really have a happy new year, everybody.
Thank you very much, Dr. Thompson, and we really do appreciate having you on WeFM each and every Wednesday, bringing to us this very educational and interesting program, Your Health Matters. And we do certainly look forward for another year of even more educational episodes of Your Health Matters right here on WeFM. And all the best to you for 2026.
Same to you. Yes.
And do take care.
Thank you.
Thank you.
Your health matters.
How much do you